Minister, I'm hoping that you'll help me to understand what the current strategy is. At the beginning of this, we were told that the strategy was to flatten the curve, that the virus would spread as viruses do, but that we needed to flatten the curve to ensure that our health system wasn't overrun and we didn't have scenes like we had in Italy and Spain. At that time, when the restrictions were introduced, numbers were rising from 170 in hospitals to 440, from 50 in ICU to 80. 4 months ago, on the 29th of April, there were 1,185 cases in hospital in Ireland, of which 120 were in critical care units. 3 times today you told us that you were looking at a complete lockdown and that we were at tipping point. We've been hearing about a lot of tipping points, though. We've heard about tipping points now since June. We were also told today by the HSE that there were 22 patients admitted to hospital with ICU and 22 admitted to hospital with COVID-19 and 6 in ICU. Now, I accept that for those 22 patients and their family, and in particular the 6 in ICU and their families, that it's an incredibly worrying and stressful time. But what I don't understand, Minister, is how you can possibly talk about a national lockdown given those figures and given that our health system coped with 1,185 4 months ago. So I want to know, what is the strategy here? What are we hoping to achieve, if not that our health system is not overrun? Because Dr. Glenn earlier this week, I note, accepted that we cannot eliminate the virus, and that seems to be the general. I accept that there are those who are calling for it to be eliminated, but he said that he doesn't think we can eliminate it here. There's a growing acceptance that you can't eliminate it, and if you do, what do you do then? You open up and you go through the same cycle. You're talking about lockdowns, and you said a couple of times that they work. Argentina has been in a lockdown for 6 months. Figures are spiralling. Earlier this week, we had the WHO on RT News saying that lockdowns don't work. It was a Hans Kluge, who was the European director of the WHO. So, where are we going? What is the strategy?
Thank you, Chair. So, first of all, you're absolutely right. I have mentioned a tipping point several times, but it's not me making that up. I'm saying it because that is NPHET's position. And I think it's natural, Chair, that we all become fatigued with this.
No,
people have been through an awful lot.
How can you...
And the reason, Chair, that I am emphasising it and re-emphasising it is because we need to be on our to be on our guard. In terms of your question on do lockdowns work, well, we know they work because we did one here and it worked. They did them across Europe and they worked. If the purpose is to flatten the curve, we locked the country down, the curve was flattened. And that has been the experience of most of the countries we've looked at.
We have no idea how many people are unable to bear. You talked about causing unnecessary anxiety by the use of the word trampoline, and I very much accept your explanation. But talking about another lockdown in circumstances where we have, and again, I repeat, 6 people in ICU, and I regret each and every one of them desperately. I lost a very close relative of my own earlier this year, and I know no matter what age somebody is at, you don't want to lose somebody close to you. Of course you don't. But we're talking about national priorities. We have 6 people in ICU, 22 in hospital with COVID-19. At the height of this, we had over 1,100 people in hospital and 120 in ICUs. And you're talking about a lockdown again. Have you any idea of the effect that that's having? Forget about the economy for a moment, but we can't forget about it for too long because something has to fund our healthcare system. They don't fund themselves. in any country in the world. Have you any idea the effect that that's having on mental health, on people's psyche, on people's spirit, on what's happening in the country now? How can you possibly talk about a lockdown, given that the figures, it flies in the face of reason? And we all have eyes, we all have a capacity to reason. We're all live in a post-Enlightenment world.
Thank you, Chair. Of course, I do understand the implications, which is why I keep saying it. It's why we brought in the measures last week, is because we must suppress the virus in our community. A huge national priority has been getting the schools open for many of the reasons you say, and that's now happening because the transmission has been reduced. But Chair, I think your question is fair in that you're saying, look, the number of cases is going up, and we know it's going up very quickly. So, for example, the key measure that the public health experts use is the number of cases over the last 2 weeks per 100,000.
The number of detected cases, we've no idea really what's happening outside of detection levels. Is that a fair thing?
We do. There was a study done estimating that the total number is about 40 to 50,000 versus the 27, 28,000 we've detected.
There are other studies that are being prepared that may or may anyway.
Okay, look, the ones that the experts talk to me about are that one, that we've detected probably a bit over a half of the total cases. But Chair, this figure that they use, we were at 3 per 100,000 a while ago. 2 weeks ago we were at 18 per 100,000, and today we're at 30 per 100,000. So let's be very clear. This virus is rising again quickly in our community. Now, I think you very fairly ask, well, how is that linked to hospitalisations? Because the cases are high, but the hospitalisations, thank God, are low. Go back and look at the profile of what happened the first time. And what you'll find is that at this point in the pattern, as the cases were in and around where they are now and rising rapidly, hospitalisations were also very low. So the unambiguous message and advice from Public Health Chair is that death will follow high numbers of cases. So what we don't want to do is wait for the hospital system to be overrun. We don't want to wait for fatalities to go up and up and up before we act. We have to act first, and that's what we're doing.
But Minister, that line, that deaths will follow increase in detected cases, it hasn't happened across North America. It hasn't happened, thankfully to date at least, across Europe.
Chair, the situation in North America, with the greatest of respect, is not one we need to be looking at to learn lessons from.
I'm not saying that Donald Trump is doing a good job, and please don't mischaracterise me. I'm not.
And I'm not. I'm not.
What I'm saying is that the increase in detected cases has not been accompanied, and it's a trend that's going on for some time in North America and the continent. It hasn't been accompanied by an increase in hospitalisations and deaths. Thankfully, that's all I'm saying.
I appreciate that, and just go back and look at the profile that happened here in March and April. And if we were back in March and April, we could well be having exactly this conversation. You could be saying, yes, cases are going up, but the hospitalisations haven't happened at a big level. Therefore, do we need a lockdown to flatten the curve? And of course, as we all know, we've had nearly 1,800 deaths. And the answer is yes, what we did was necessary. So there are no easy answers to this, Chair. And what we're having to do is move early to stop the fatalities and stop the critical care admissions and stop the hospitalisations. And I would just emphasise again, Chair, the success of Kildare, Laois and Offaly is that the communities there have shown that relatively reduced measures, certainly compared to a lockdown, not only do they work, but they work very quickly. And simply that is what we're doing. And Chair, I'm more than happy to stay for as long as you want and answer any questions. But if you'd allow me to just make the following ask and say the following thing as well. Speed matters. So how fast we moved in the 3 counties mattered. How fast we're moving in terms of the national measures matters a great deal. And critically, how quickly individuals respond matter. So there's very rightly in the committee been a lot of focus on the turnaround time for testing. Absolutely right. And we'll continue to bring that down and down and down. But you know, the other part of that is the individual responsibility we all have to take. So my ask is for people, if you feel symptomatic, to not do what we all do in the normal world, which is to wait a few days and see if we'll be okay, is to go immediately to the GP. So, Chair, if we all act, if we all move early and put up our hand and say to a GP, yeah, I've got one of the symptoms, can I get a test? If we follow the public health guidelines around social distancing and face coverings and the other things, we will move through this without the harsher measures, and that is exactly what it is we're trying to do. For example, we've obviously got to open the schools, but in my brief, we have to get the healthcare system back up to capacity, and higher capacity than it had before, because of the enormous number of men, women and children waiting for healthcare.
And I know that you're going to provide the committee with the figures on how that capacity has increased in the coming days, and I thank you. Minister, I just join with you in asking people to behave responsibly, to take personal responsibility for their actions, to adhere to the measures that have been outlined. But speaking personally, I really would caution about talk of another lockdown, because there is a risk of unleashing a whirlwind. That's my personal view. I really am not convinced that you will bring the country with you on that.
Yeah, thank you, Chair.
And that's not a committee view, that's a personal view.
Yeah, and I accept that, and I fully accept your view. But Chair, we're in a world where there are no easy answers. We are dealing with a global pandemic and a highly effective, vicious virus that we know kills people. And there is emerging evidence as to some of the longer term health impacts for people and jobs.
Thank you, Minister. I just want to ask a question of more local interest to me. I don't expect a reply now, but maybe you could provide one in writing. It was the HSE told us earlier today that the department had engaged the DAA to carry out the follow-up calls for people coming into the country. I suppose I'd like to know what tendering process was done around that, or how Dublin Airport was selected over, for example, Shannon Airport, which is now going through a round of redundancies, you know, because there's a lot of capacity there too, and sometimes it appears that there's only one airport in the country when it comes to Irish officialdom. If you want to reply now, you're welcome to, but otherwise I'd ask you to reply in writing. It's up to yourself, Minister.
Thank you, Chair. No problem at all, and I'll get you more detail in writing, but the short answer is actually the Department of Health has procured the contract.
Yeah, with the Dublin Airport Authority, but how?
No, with a private firm to do the work. So the DAA was originally looking at it, but it was my department has taken that over and procured the contract.
Okay.